Hello, I'm Hugh Ross. I'm an astronomer, the president of Reasons to Believe, and we've been getting a lot of questions about this coronavirus. And I'm joined here by Anjanette Roberts. She's on our staff. She's a molecular biologist and a virologist. And AJ, can you tell us a little bit more about this virus?
So first of all, I just want to say that, we're not the Public Health Department. We're not the Centers for Disease Control. And those are two great resources where you can go for actual statistics and precautionary actions that you should be taking. And we don't want to replace any of those public health service organizations. What I basically tell people is, I worked on coronaviruses at the National Institutes of Health for about 3 years during the first outbreak of a coronavirus, also coming from the southern part of China, and that was called SARS. And this virus is also being called SARS-2 because of the similarity. It's the same type of virus, the same virus family. A lot of people will compare this virus also to influenza virus. And although the symptoms, if you contract SARS-2 or influenza virus, might present similarly at the beginning with a cough and a fever and body aches, the two viruses are actually very different biologically, and they're also very different in the way that they behave inside the human body and outside of the human body. But what we're also seeing in this particular outbreak is that people can pass the virus to another person when the person who's passing the virus has no symptoms of illness, and that the incubation period could be as long as 2 weeks and perhaps even longer. And so if you're actually introducing the virus to somebody else who's in one of those vulnerable populations, either the elderly or somebody who has an underlying disease that you may not even be aware of, because many of the underlying diseases are ones that don't have physical manifestations. So you could be passing the virus to somebody who's susceptible, even though you yourself are healthy. And so I think that's another way that we can love our neighbor, is to just take these precautions, stay abreast of the situation, pay attention to what's going on, follow the health recommendations of officials, and if we're all taking these precautions, then we're going to help create a safe environment for everyone. And I think that's one of the ways that we can love our neighbors in very practical ways, like Christ calls us to in the story of the Good Samaritan. So, I think I just want to re-emphasize that the situation is still very early in the outbreak. The original SARS outbreak lasted 8 months. The flu season usually lasts from about October through May. And we're only 4 months into this particular coronavirus outbreak. And so it's an evolving situation.
Okay, we're a science-faith organization. We're Christians. We want to continue to equip you so that you can understand what's going on here and also be prepared to help one another, to serve one another, and to love one another.